Endoscopy is a diagnostic technique that gives us images of the inside of the human body and helps us perform surgery and detect diseases. Traditionally, the technique has used an endoscope, a long thin tube with a camera that is inserted into the patient's body. This isn't a pleasant process, as the tube has to be inserted through a body cavity, and the patient normally has to be anaesthetized. Plus, it requires many professionals, proper facilities, and complex medical devices. And that means time and money. Thanks to scientific advances, we now have the endoscopic capsule, a minuscule device the size of a pinhead that patients can easily swallow. The device records its trip through the esophagus, stomach, and intestines. The images are transmitted using radio frequency and recorded. The capsule ends up leaving the body naturally. It is a non-invasive process. That means that we don't have to use facilities, other devices, or professionals. It does pose a significant problem, however. A specialist has to individually review each of the more than 500,000 images collected along its path through the body, which takes many hours of tiring work. Our artificial intelligence system speeds this process up significantly. These techniques are based on neural networks, a computation tool that aims to simulate the architecture and internal operations of the human brain and nervous system in its ability to learn, generalize, and quickly process large amounts of data. These networks can be used for tasks like classifying a large volume of images. Artificial intelligence based on neural networks can use a computer to analyze the 500,000 images the endoscopic capsule captures and select the ones with some kind of anomaly. The specialist only has to look at these images, and the whole process can be reduced from up to 3 hours to just minutes. Another significant advantage of the system is that the patient can live their normal life while the procedure is underway, plus the savings in terms of both time and resources for public and private health administrations. The artificial intelligence system democratizes access to screening so that as many patients as possible can benefit from early detection of diseases.